Hi everyone, today we are going to present to you our video assignment entitled of Aspirin, or known as Acetysalicyclic acid. So let's get started.
Aspirin, known chemically as acetylic acid, is a synthetic derivative of salicylic acid, a compound found naturally in various plants. The most notable natural source of salicylic acid is the willow tree, which is genus Salix, whose bark has been used for centuries in traditional medicine for its pain relieving and its anti-inflammatory properties. Another plant known for its salicylic acid content is meadowsweet, which is Filipendula ulmaria, which has been also been historically utilized for similar medical purposes. In plants, salicylic acid plays a crucial role in regulating growth, development, photosynthesis, transpirations, and ion uptake, as well as acting as a defense hormone against the pathogens and environmental stress. Aspirin itself, with the chemical formula C9H8O4, is synthesized through the esterification of salicylic acid with acetic anhydride, producing acetylsalicylic acid and acetic acid as a byproduct. This synthesis process, first successfully developed by Felix Hoffmann at Bayer's in 1897, transformed aspirin into one of the most widely used medications for pain, fever, and inflammation relief. Aspirin's IUPAC name, 2-acetoxybenzoacid, tells us about its molecular structure. The name indicates that the compound has an acetoxy group and a carboxylic acid group attached to a benzene ring. There are two key functional groups in aspirin, which is one, we call it the ester group, which in this case is an acetate group. It connected to the benzene ring. Secondly is the carboxyl group. A carboxyl acid group also attached to the benzene ring. Aspirin belongs to the homologous series of carboxylic acid and ester. Specifically, it is a part of the aromatic carboxylic acid and aromatic ester series, characterized by the presence of a benzene ring with both of a carboxyl group and an ester group.
Now, let's get known about chemical and physical properties of aspirin. For the chemical properties, firstly, aspirin can easily get hydrolyzed on coming in contact with moist air. Secondly, it can easily decompose in a few solutions. Thirdly, it can be explosive when mixed with air. And lastly, it can act as an anti-inflammatory, anticoagulatory, and analgesic. For the physical properties, the molar mass of aspirin is 180.16 gram per mole. Its melting point is 136 degrees Celsius. Its boiling point is 140 degrees Celsius. Its density is 1.40 gram cm3. And lastly, aspirin is soluble in water.
Hi, I will explain to you about benefits and uses of aspirin. Aspirin, a widely used medication, offers a range of benefits beyond its primary role as a pain reliever. Its diverse properties make it a versatile tool in healthcare, with application ranging from reducing risk of cardiovascular events to alleviating inflammations and pain. Here are some key benefits of aspirin. Firstly, aspirin helps to prevent second heart attacks and stroke. Aspirins prevent clot from forming in the blood vessel and blocking blood supply to the heart and brain, as well as other parts of the body. That can help prevent heart attack or stroke from occurring. The issue is exactly who should take daily aspirin to prevent cardiovascular disease and event. Previously, many doctors recommended that even healthy people take a daily low dose aspirin to prevent a first heart attack or stroke. But with the evidence that bleeding risk outweigh benefit for people at low risk of cardiovascular disease, is no longer routinely advised for people without a history of or increased risk factor for heart disease. On April 26, the U.S. Preventive Service Task Force finalized its recommendation against starting daily aspirin for primary prevention of cardiovascular disease in adult age 60 or older. For adults between 40 and 59 with a 10% or higher risk of CVD within the next 10 years, an individualized decision should be made by doctor and patient. The update recommendation also lowered the minimum age for considering preventive aspirin, which previously started at 50. That stand alike with the American Heart Association recommendation, which state aspirin should be used rarely to help prevent heart attack and stroke among adult age 40 to 70 without known cardiovascular disease. However, this recommendation do not apply to people who have had a heart attack or stroke or have a stent in artery. Those patients should remain on aspirin as prescribed by their doctor. Secondly, aspirin help in lower preeclampsia risk during pregnancy. Preeclampsia is a pregnancy-related condition involving high blood pressure and potentially serious complication for the mother and the fetus. Recently, the U.S. Preventive Service Task Force reaffirmed its recommendation for low-dose aspirin after 12 weeks of gestation to reduce the risk of preeclampsia among those at high risk. The USPSTF conducted an evidence review of 23 randomized clinical trials involving nearly 27,000 participants. Aspirin use was associated with a significantly lower risk of preeclampsia and outcomes such as preterm birth and fetal growth restrictions. In the review published September 28, 2021 in the Journal of American Medical Association. Besides that, aspirin helps in fever reduction. Aspirin is also used to reduce fever. It works by affecting the hypothalamus, the parts of the brain that regulates body temperature. Next, I will explain to you about usage of aspirin. The usage of aspirin varies depending on individual health conditions and needs. Here are some common applications. One of the primary use of aspirin is a role as an analgesic or pain reliever, where there is a headache which helps effectively for tension headache and migraines. While in muscle and joint point, it commonly used for conditions like arthritis and muscle sprain. Meanwhile, in third act, it can alleviate pain from dental issue. And in menstrual cramps, aspirin helps to provide from painful periods. Aspirin is often the go-to choice for many individuals seeking relief from mild to moderate pain. Moreover, aspirin acts as anti-inflammatory properties, make it particularly used in treating conditions such as arthritis, which used in conditions like rheumatoid arthritis and osteoarthritis to reduce inflammations and pain. While in bursitis and tendonitis, aspirin helps to alleviate inflammation in bursae and tendons by inhibiting the production of prostaglandin. Aspirin helps to reduce swelling, redness, and discomfort associated with inflammation. Last but not least, aspirin used as a miscellaneous usage. Sometimes aspirin prescribed after certain types of surgery to prevent blood clots in post-surgery. While in polycythemia vera, aspirin helps to reduce the risk of blood clots in people with this condition, which cause an increase in red blood cell productions.
Finally, we are going to talk about the chemical reaction. There are two examples of the chemical reaction. The first one is synthesis of aspirin, and the second one is the aspirin in the body, which involve hydrolysis process. As a reminder, aspirin synthesis should be attempted in the controlled laboratory setting with the proper safety measure due to the uses of the hazardous chemical. Now let's take a look at the synthesis of aspirin. Aspirin, known as acetylsalicylic acid, is synthesis from a reaction between salicylic acid and acetate anhydride acid reactant. A catalyst, typically sulfuric acid, is used up to speed up the reaction. The overall reaction are like this picture in the middle, where salicylic acid plus acetate anhydride will produce aspirin and acetic acid. For the mechanism, it involves the few steps. The first step is protonation. The acid catalyst donates a proton which is H+ to the carbonate oxygen C-double-O to the acetate anhydride. This increases the positive in the charge of the carbonate group, making it more susceptible to attack by the nucleophile. The next step is nucleophilic attack. The hydroxyl group of the salicylic acid acts as the nucleophile and attack the electrophilic carbonyl carbon of the protonated acetate anhydride. This forms a tetrahedral intermediate. Last step is proton transfer and bond formation. A proton is transferred from the hydroxyl group of the intermediate back to the nearby oxygen atom, forming the carbonyl group in acetic acid. This also breaks the bond between the carbonyl carbon of the acetic group of the anhydride, forming a ester linkage between the salicylic acid and the remaining acetic group. The final product is aspirin, and acetic acid is released. So next we move to the second chemical reaction, which is aspirin antibody that involve hydrolysis of aspirin. Aspirin, known as acetylsalicylic acid, undergoes hydrolysis, a reaction with water to break down into two products, salicylic acid and acetic acid. The first step is protonation. A water molecule gains a proton from the surrounding environment, creating a hydroxide ion. The next step is nucleophilic attack. The lone pair of the electron of the oxygen of the hydroxide ion attack the carbonyl carbon of the ester bond in aspirin. Next is tetrahedral intermediate. A tetrahedral intermediate forms with the carbonate oxygen bond to both the original aspirin molecule and the OH from the water. Next step is carboxylate group as a base. The carboxylate group of aspirin acts as the base, pulling a proton from a nearby water molecule. This regenerates the carboxylic acid group in aspirin and creates another hydroxide ion. The last step is bond cleavage and product formation. The weakened carbon-oxygen bond in the ester breaks, and the tetrahedral intermediate fragments into salicylic acid and acetic acid. So, once ingest, aspirin undergoes hydrolysis reaction with water to convert back to salicylic acid, which is the active ingredient causing the pain-relieving and anti-inflammatory effect. So in conclusion, aspirin is a drug or medicine that has been used for a long time, and its positive effects are quite well known. The chemical structure of a compound, especially the presence of the ester bond, make it prone to breaking down in the body through hydrolysis. This hydrolysis is vital for aspirin's function. Aspirin, on the other hand, have analgesic, anti-inflammatory, and antipyretic properties, but it's the salicylic acid that it generates because of the hydrolysis that is therapeutic. Knowing the chemical composition of the aspirin will help us understanding of how the compound works in the body and how it reduces the discomfort, fever, and inflammation.
So here are some reference if you guys want to know more about aspirin or acetylsalicylic acid. That's all from us. Thank you for watching. Bye bye.